Welcome. I'm Professor Gerard Sutton. I'd like to introduce Professor Michael Lawless and Professor Colin Chan. And we're just going to have a chat about some of the common issues and questions that people who are considering laser eye surgery often ask. So I'll ask you first, Colin. What are the things you think that patients are worried about, the questions that they ask you when they first come to see you when they're thinking about laser eye surgery?
I think one of the most common questions they actually ask is, how can I get through this procedure? And am I going to have to stay really still? Am I going to do anything wrong that will mess it up? And I tell them, well, it's really not much more difficult than going to the dentist. In fact, people say it's far easier, that you just need to lie there relatively still, to stare up at the ceiling, and then everything will go by very quickly. So I think once patients actually hear that, then they're actually reassured, well, okay, I don't have to stay stock still. If I move a millimeter, it's going to somehow foul things up. They typically get anxious about things like that.
And one of the other things that they worry about the surgery is whether or not it's uncomfortable or painful. What do you tell them?
I tell them, again, similar to my analogy with the dentist, that they might feel a little bit of pressure, a bit of sensation that something's going on, but they won't feel any sharp pain. The anesthetic we give them, I tell them, is very powerful, and they won't feel anything that's actually painful.
And I guess it's also important to remind people that there is the option of a pre-med beforehand, which tends to take the edge off the anxiety, and anaesthetic drops, of course, which also help significantly reduce the discomfort. And Michael, what about you? I mean, questions that patients who are coming in to see you for laser eye surgery commonly have.
Gerard, I think the most common question I get asked is, am I suitable? And that's actually a nuanced answer. It depends on the health of the person's eye. It depends on the error that they have. Are they really short-sighted? Are they long-sighted? Is there coexisting astigmatism? So it depends on the optical error, the health of their eye, their age. And as a doctor, you have to, I try to give them an answer that is particular to them. And so most people are suitable for one or other of the variety of procedures, but some people are not suitable for any surgery, and that needs to be made clear to them. And some people are in a little grey zone where if their expectations are appropriate, they can proceed. So it's a nuanced answer. The second thing, I think, the most common question I get, Gerard, is they ask, when can I go back to work? And again, that depends. If it's LASIK, sometimes I can go back to work the next day for a moderate error. At the other extreme, if it's PRK, where we laser the surface, it goes under different names, sometimes it's a week or two before they really feel comfortable going back to work. So how quickly can they get back to their activities and work is a frequent question for me.
Mm-hmm. And one of the other issues, I guess, which I'm going to ask both of you is what you say to a patient coming in if they ask, how safe is a standard laser eye procedure? So Michael, back to you. What's your response to that?
Yeah, if they are suitable, that is, their anatomy is suitable, the error is suitable, and they say, how safe is it? Well, I say it is extremely safe, but the risk is not zero. And I try and draw the analogy with contact lenses, because, for example, laser refractive surgery done under the best circumstances for the right anatomy and error is approximately as safe as continuing to wear contact lenses for a 2-year period. Now that's an approximation, but neither are zero risk, but both are extremely safe things to do. But this is surgery, and so it's reasonable to hone in on a risk for that event, as opposed to a risk which is spread over time, which it is with contact lenses.
That's a good answer. Thanks, Michael. And I guess, Colin, the other thing that people often ask me is, how long is this going to last? I mean, am I going to be able to expect this to last forever? Or is there a time limit on the efficacy of the laser eye surgery?
I mean, that question's a lot dependent, as you know, on the age of the patient. And so if you're like a 25-year-old who's having laser eye surgery for short-sightedness, then you can expect that laser to actually last for a good 20 years. And one of the reason why it only lasts for 20 years, not so much that the laser wears off, but because we can't yet stop the aging process. So once you reach 45, like everyone else, you'll need reading glasses. But the laser itself effect is mostly permanent, except maybe in about less than 1% of people who undergo a degree of what we call regression, or the eye heals out some of the changes. But again, that's less than 1% of the people we see. So it is, in all other aspects, a very permanent condition, permanent effect, but you can't stop the aging process. So it depends a bit on what age you are.
I think there's a little bit of a difference then between some laser eye surgical procedures and a laser lens procedure, so replacement of the lens, and those procedures tend to be permanent. And would you agree with that, Michael?
Yes, a lens procedure.
It's a qualified yes, Michael.
Well, it is qualified because very few things are truly permanent because other things can impact the health of the eye. So that lens replacement in an older patient, the optics are then permanently altered, but they can get other unrelated things like glaucoma or other disease when they get older. So a qualified yes, I think.
And so I think that what we've tried to do today is just to sort of discuss some of the common questions and concerns that patients who are interested in laser eye surgery often have. So I'd like to thank Professor Michael Lawless and Professor Colin Chan. Any other final comments? Are you happy with that?
No, I think it's a pretty good discussion about those frequently asked questions that patients have. Thanks, Jared.
Okay, cheers.
Thanks, Jared. That's
No
great.
worries.